Hi, this is Dr. Doug Lucas, the Chief Science Officer of PhD Weight Loss and Nutrition. So we've had a lot of questions recently about oatmeal, and I wanted to bring up two important aspects for our clients and followers. So one is that the studies and media articles that have been coming out have been saying that oatmeal is good at controlling blood sugar in diabetic patients. The other thing that these articles are talking about is that oatmeal is good for heart health. So I want to address those two things. So first, with the blood sugar, when you look at the articles that are coming out, even the articles that cover all of the articles that have come out over the last 15 years, they all look at a diet containing oatmeal versus the standard American diet. Now we know that when people are eating a standard American diet, they are not eating a healthy diet. It typically has a lot of highly processed foods in it, a lot of sugar in it, a lot of vegetable oils in it. And if you eat anything in contrast to that, it's going to look better. So we really have to take that into consideration when we're saying that a diet with oatmeal improves anything about the outcomes of a diet intervention. None of these studies are looking at a diet with oatmeal versus another improvement from the standard American diet, unfortunately. Regarding the actual effect for diabetics, though, the statement is that it improves blood sugar. Well, again, compared to the standard American diet, that's true. However, oatmeal is a very dense carbohydrate, and a portion of it is quite small. But even if you eat a small portion, it's going to have a significant impact on your blood glucose and subsequent insulin release. So I've been doing a personal test on this. I have some metabolic dysfunction and glucose dysregulation, and I've been wearing something called a CGM, or a continuous glucose monitor. You can see it on my arm right here. And I have been doing tests of instant oatmeal versus slow-cooked oatmeal and compared that to something sweet like ice cream. And what I can tell you is that in my body, the effect of the instant oatmeal and the slow-cooked oatmeal were very similar, and both of them had a larger sugar effect, larger likely insulin response than the ice cream. So eating something like that for breakfast as a diabetic it's going to be really challenging to control from a medication and nutrition perspective. When you look at the heart health side of it, these studies do show a decrease in cholesterol. So there is a beneficial effect in the cholesterol profile when you consume oatmeal. That's because of part of the soluble fiber in the oatmeal is called beta-glucan, and that causes this improvement in cholesterol. But what you have to realize is that it's a small improvement in cholesterol, and it is going to have minimal impact on your overall risk. And if that comes at the cost of having higher blood glucose, higher levels of insulin, which would cause higher levels of inflammation, you are really taking a very small beneficial effect and trading it for something that's actually much more risky. So I hope you find that helpful to clarify this for people that have metabolic disease, which again is about 90% of the American adult population. That's all I have for right now. This is Dr. Doug Lucas, supporting your performance, health, and diet, PhD.